Hello everybody, welcome back to Creating Hanley. I am Kimberly at Creating Hanley, and today's episode is a Massage Monday episode where we talk about massage and massage related topics. Alright, so let's get into it. So I kind of have a rant, and I'm just going to shoot from the hip today. And I've actually started this video a couple times, probably like 3 or 4 times already, but let's see if I can shorten it down a little bit. Got interrupted by the cat. Anyway, let's do a topic verse comparison. So deep pressure versus deep tissue. Do you guys know the difference between deep pressure and deep tissue work? It's a question. Do you know the difference? Do you think you know the difference? So I don't know why Americans like to be steamrolled in this country. Apparently, U.S. citizens like to be steamrolled for whatever reason. But they think they get more bang for their buck if they get a heavy pressure in massage. No, that's not the case. They just get banged up in a heavy pressure massage. So notice I said heavy pressure. It's pressure. It's not necessarily deep tissue. So deep tissue work. What is deep tissue? So deep tissue can be the soft tissues in the body that maybe surround the delicate parts of our body, like our spinal cord, our brain. Those are pretty deep tissues, right? Are we going to be able to steamroll our way through bone? No. We cannot do a heavy pressure, elbow to the forehead, and get a good massage there. That's not going to happen. So, deep tissue can work very delicate spots. So, like the meninges around the brain, the dura mater around all the central nervous system. You can work those very fine myofascial connections. The fascia is connective tissue everywhere in the body. Fascia connects every cell together. You can get, other membranes are soft tissue. So, for example, joint capsule, cartilage, ligament, tendon, of course muscle, of course fascia. Skin is a tissue, of course. So is bone and blood. Those are tissues as well. Now, there's no way that we're going to, as massage therapists, force our way through a bone to get to the other side of that bone to get to whatever soft tissue is on the other side of that. We are not going to do that. And if that happens, you will end up in the ER because now you have fractured bones. That's not our aim as a massage therapist. Now, for you guys as customers or clients of massage therapy, generally people ask for deep tissue. I want deep tissue work. What I think they're thinking of is deep pressure. So they want a heavier pressure. So deep tissue work can be orthobiotomy. It's very light work. It can be craniosacral, very light work, the weight of a nickel. Myofascial, very slow, light work. Even Reiki is deep tissue, and that's not even touching the body at all. So these are very deep tissue types of massage modalities. And if you ask for deep tissue, I might ask you, what are you looking for? Because maybe I'm trained in it and maybe I'm not. But most likely you're asking for deep pressure. You want more pressure in the massage. And again, Americans like more bang for their buck, and they think heavier pressure will do more in a less amount of time, and that is not necessarily the case. So what happens with deep pressure, if it's too much for your body to handle, is that the body tightens up. The muscles get tight, they start to guard against that pressure, they're revolting, they're rebelling, they're pushing against it, so we're pushing down and they're pushing back because they don't like it. Now, there is like a fine line. There's a sweet spot. There's a point where you can press a little bit harder and it still feels good. So it's like that hurty goodness, that pain that feels okay. That is okay. That's the fine line. Once you get into sharp pain, or you're just holding your breath, or you're tensing up, or your muscles go into spasm, it's too much, okay? So that's my little rant. When you see deep tissue on the menu at a massage place and you choose deep tissue, you're like, yes, choose that. It's going to be more expensive because we massage therapists have to work harder. And we know deep tissue and deep pressure are kind of synonymous on those menus. However, that is technically not the case. Deep tissue can be very light, can be the weight of a nickel, can be no touching at all. So we have to work harder to access some of those, bigger muscle areas, and it takes a toll on our body. So that's why we charge a little bit more for a deep tissue massage. Just know that there are other modalities that get deep tissue without pressing very hard at all. In fact, that may even be more beneficial to you as a client, as a customer, okay? And depending on where you are, maybe even as a patient. So if you want manual lymphatic drainage, another one, very light works some deeper tissues in the body. In manual lymphatic drainage, we're just moving water in the body. It does not take a whole lot of pressure to move water. If you put a couple drops of water on, go do this test right now. Put a couple drops of water on your kitchen counter and move your finger through it. That water moves pretty easily, right? Drop a red brick on your kitchen counter. Try to move your finger through that. Not possible. It takes a lot more effort on your part to move that red brick, right? So manual lymphatic drainage, all we need, just enough pressure to move that water. So know why you are requesting the massage that you are. There are so many, I think there's over 100 modalities of massage out there. You are not the expert. As the customer, you don't know what all those terms mean. What does craniosacral mean? What does Reiki mean? What does Shiatsu mean? You probably are not an expert in those. And many massage therapists are not experts either. We get the basics in Swedish massage school here in the United States, which is Swedish. Swedish is the foundation. There are many techniques in the Swedish modality that we employ during your massage. You can get sports massage, you can get chair massage, and it is all based on the foundation of Swedish massage. So Swedish is not your typical fluff and buff, spa resort kind of, boop, 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 sprinkle some holy water on you and send you on your way. No, Swedish massage is a real massage. You're going to get benefits from Swedish massage. So don't feel like you need to always hit the deep tissue button on your menu item at the resort or spa. You can get a Swedish massage. Just, communicate with your massage therapist. Okay, I think that was enough of a rant. Does that make sense to you guys? Deep tissue versus deep pressure. There's a difference. Most Americans like to be steamrolled for some unknown reason to me. Why y'all like to be steamrolled? You need to think about that one. But deep pressure and deep tissue, completely different. They can be one and the same. We can use deep pressure to access deeper tissues in the body, but they're not synonymous terms, although we tend to use them that way. And I kind of blame our industry for that because people don't really know what the other modality terms mean. They don't know the definitions of all these different, types of massage. So we just say, it's deep tissue and call it that. And then everybody's like, yay, let's do that. And you don't need to know. When you go to your surgeon, if you have a surgeon for some reason, do you know all the different types of surgery there are? Probably not. You're not an expert in that. Surgeons are experts. And not only are surgeons experts, but surgeons are very expert at one thing. Massage therapists, they tend to branch out. I'm looking up at my wall, all the different diplomas. You may not even know what a lomi massage is. Have you ever had that before? Maybe try something like that. It's a little bit different. Hot stone, cupping, all kinds of different things. So just know, deep tissue versus deep pressure, they're different. And when you go get a massage, deeper work, painful work is not necessarily more bang for your buck. You might be backfiring in your plan there. So leave money aside. Don't let money or the price of the service sway you in which massage type you get. Ask a professional, ask a massage therapist what your so you go over your health history intake form, you do all that, and don't leave stuff out, because we need to know this stuff, what's going on with your body. If there's a contraindication that we should know about and we do something that hurts your condition, we should have known about that. That's not a good thing. That's probably not going to be a good outcome for you. So don't leave anything out. The health intakes are important. I know nobody likes to do that, and sometimes they leave things out. But please don't do that. So just communicate with your massage therapist on maybe what types of modalities that they specialize in and might be beneficial for you. It's not always deep tissue. It's not always deep pressure. All right, guys, that's my rant for the day. I hope to see you on the massage table. Get one every week. Get one every month. Don't wait till your birthday or Christmas. All right. Bye for now. Have a good one. Stay safe out there and go get a massage. Bye.